Starting with roll call, we have Jeannie,
Here.
Larry,
Here.
Steve,
Here.
Ann,
Here.
and Stacy.
Here.
All right, I almost said Daisha. Notice of meeting.
Meeting is properly noticed.
I need a motion to adopt the agenda.
So moved.
Second.
All in favor, signal by saying aye.
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 All opposed? All right, if you would all, please join me in standing and saying the Pledge of Allegiance. Well, tonight we're gonna have a new member of the team come on board here. Yep. Wasab Tareen is going to be our new representative, replacing Noah. So, come on down.
Is this microphone working? Is this on? Hello, test. Okay, so what we're going to do is I'll just run through it. Good evening, everyone. My name is Larry Dukes, and I'm the board clerk, and it is my duty and responsibility to swear in new board members, or in this case, a new student representative to the Pewaukee School Board of Education for the Pewaukee School District. So, I'm going to have him, I will say it, and then he'll repeat after me, and then we'll be done with this swearing in or official pledge to serve. So I'm Wasab Tareen, who have been duly selected to serve as a student representative to the Board of Education of the Pewaukee Public School District.
I'm Usab Tareen, who have been duly selected to serve as a student representative to the Board of Education of the Pewaukee Public School District.
Swear that I will represent the interest of all students, support the mission, vision, and values of the Pewaukee School Board, and will faithfully discharge the duties and responsibilities as defined in the Board of Education Policy number 5700.06, Board-Student Representative to the best of my ability.
Swear that I will represent the interests of all students, support the mission, vision, and values of the Pewaukee School Board, and will faithfully discharge the duties and responsibilities as defined in Board of Education Policy 5700.06, Board Student Representative to the best of my ability.
Please sign it, and congratulations, and welcome to the board. Yeah. So he's actually our third representative to the board, right? So you're kind of still breaking new ground for us, but thank you very, very much. I appreciate your willing to serve, and thank you, Principal Sniff, for helping us select another great candidate. And good evening to you, too. So thank you.
Thank you, Larry. All right, I'm going to open it up to board members to give any salutes or recognitions they have. Steve?
I'm going to steal one that John hinted at earlier tonight. Thanks, John, for sharing the opportunity. Jeff Behrens apparently has been doing a great job managing post-school activities to help us deal with our transportation challenges with bus driver availability and routes. So I want to recognize Jeff for his great work to work with the other districts to make sure that we resolve those and have the least disruption possible for our students who are trying to get home from school and get to these other events.
Larry, do you have that?
Yes, either John, and is John Stangler here tonight too, or just John Gahan? I had the opportunity to attend the first football game, I think, which they were playing on a Saturday afternoon in the brand new seating stadium, whatever you want to call it, out there for the bleacher seats. And then I also sat through a little bit of a rainy game a week ago or so on a Friday. John, and the seats were fantastic. The bleachers were great, and they even bought, I think, a few raffle tickets from Mr. Stacy down there, and her husband were selling tickets that evening. It was a great event, and really proud of the fact that we have a really nice facility out there now on both the visitor side and the home side. So, looks good.
I'll open it up to administrators.
Yeah, I was just gonna echo what was already said in terms of welcoming Musab and complimenting Mr. Sniff, who really was one of the big drivers, along with board members, to have a student representative. Mr. Sniff had experience in his previous district with it, so he really brought the process forward and has been instrumental in having the student representative. So again, I just want to take the opportunity to welcome Musab. Welcome back Khadijah, who was a fantastic rep for us last year. And again, thank you to Brian for his work to help them make sure this happened.
Anything else? All right. After that, we have comments from citizens. Julie's going to collect any cards that anybody might have. That'd be the audience participation time. If you have a card, to bring it down. Okay. Usually when I try to move on, somebody runs down, but okay. Let's move on to the consent agenda. We have the minutes from the previous meetings, August 9th, there's two of them, and the 23rd, a special meeting where we hired somebody. Correspondence, and there are no gifts at this time. So unless there's questions or corrections, I'll ask for a motion to accept the consent agenda.
Move to approve the consent agenda as presented.
Second.
Thank you. All in favor, signal by saying aye.
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 All opposed? 6-0. I'm going to turn it over now to Steve for the Business Affairs Committee, who met early tonight.
We did our normal agenda of items, reviewing the check registers, found everything to be in order, the financial reports, and they are to be what we would expect at this time of the year, with expenses starting to accumulate and very few revenues that we can account for at this point of the year, with all of our funding coming later in the year. So everything is as we expect it to be. We went through and reviewed the upcoming financial calendar, business affairs calendar for the remainder of the year, the things that we will talk about at each of the scheduled meetings, and John presented that to us, and we had a conversation about that. And we also went through and started touching base on what John's expectations are for the first official budget for the 2021-22 school year, and what we might see in that budget that will be presented to the board on October 25th, including some conversation around Third Friday counts, which happen next week, and the timing of those getting certified. OPEB's study being finalized now, so we have those numbers in. We had some conversation around state funding, federal funding, and the timing of those, finalization of those things. So much more to come in front of the board in the next 6 weeks as it relates to the 2021-22 budget, but we had some initial conversations around those items. And that's what I would have to offer tonight.
Anybody have any questions for Steve or the committee? Thank you, John, for answering my, or clarifying those questions I had. So, if that's the case, then I'll need a motion to accept the business affairs report.
Move to approve. Second.
All in favor, signal by saying aye.
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 All opposed? 6-0. Down to new business. We have today with us David Woodford, talk about Wisconsin Youth Risk Behavior Survey update. So.
Yeah, I'm going to have David come down, and as the board knows, the Youth Risk Behavior Survey is something that we've used for a number of years. This is the first time that it's available since 2019 because of COVID and the shutdown. It didn't happen in the spring of 20, so we have a little bit of gap in our data. David's this is an informational item for you. He's going to provide an update in terms of the survey, where we're at with it, the kinds of information we get, how we use it, and answer any questions that you have. So with that, I'll turn it over to David.
Sure, and thank you, Mike. I think Mike took a couple of my really important talking points, but we'll just go through the presentation. So there have been, as Mike mentioned, a couple of excuse me, updates to the Youth Risk Behavior Survey as provided by the Department of Public Instruction, and one of those being the administration window. Since 2014-15, when we began using the Youth Risk Behavior Survey, that's been a spring administration, and they've shifted to a fall window, which is why we have the date TBD by December 10th. That is the point at which DPI stops supporting and allowing us the computer access to administer the survey. So just by way of review, because I know we have some folks who were not on the board back in 2014-15, the Youth Risk Behavior Survey is conducted as part of a national effort. It's been around since the 1990s and has seen minor revisions in every 2-year iteration since that time. And then the O, when we talk about OYRBS, refers to online. Back in the old days, the ancient 1990s, it was administered as a paper fill-in-the-bubble survey. Now it's done entirely online with clicking dots. So it's supported by DPI, and I'll talk just a minute about how some of the ways that we use it. And it's administered in grades 7 through 12 in Pewaukee as something that the board made the choice to do rather than including the entire 6 through 12 population, which is what it's been developed in order to do. Just to, at the time, the 6th grade was not housed in the middle school, and because of the sensitive nature, we've made that choice and would recommend at this time continuing to make the choice to not include the 6th graders in that survey. And part of the reason for that is the categories of questions, some of them are a little more sensitive in nature. And it covers really a number of types of questions about health risk factors, as well as health promotion factors, things that lead to health and wellness. So we have everything from vegetable consumption to bike helmets and texting while we're driving to some of the more sensitive topics that you see up here. And again, I would point out to the fact that there are separate questionnaires that are available for the high school versus the middle school. The high school questionnaire gets into a little more detail and doesn't get into as much, or gets into a little more specifics with some of the content, and also has questions about texting and driving, which of course that sort of thing would not show up on your middle school questionnaire. So it's a 60-some item questionnaire for the middle school and a 90-some item questionnaire for the high school. It takes about 20 to 25 minutes typically for students to complete it. We never receive any data on individual students. Students never enter any individual data about themselves other than demographic information. So they're not including name, they don't have individual logins. It's never even processed through our data processing or DPI's. It goes directly to a contracted vendor, and then we receive the report, which is disaggregated of any of that information. It serves to allow us to kind of guide and steer some of the things that we're doing with health and wellness in the district. It also can help us to focus on staff training, homeroom topics and things that we would cover with students, and as well as school-wide programming. I would point to some examples of events that we were able to steer towards and point ourselves towards. When we started doing the Youth Risk Behavior Survey, vaping really hadn't hit in a big way. And since then, some questions about vaping have been included that have allowed us to do parent presentations. Mike was able to bring in screenagers, which was and then we had a panel discussion for our parents as well that really talked about some of the risks associated with overusing screen time and smartphones, social media, and things like that. And so it has proved to be a pretty valuable tool. And another way that it's valuable for us is a metric doing as compared to state data, local data from the county level as well as national data. And I'm happy to report that the general trend is that we're doing better than all of those categories of behavior, and almost universally as we look across. But we do find useful information on this survey nevertheless. I think it surprised a lot of us, for example, to find out that 31% of our high school students had tried vaping. I don't think most of us expected that number to be that high, for example. As I mentioned, it's anonymous. It's conducted through a secure internet connection. It's done in classrooms with the classroom set up so that students can't see each other's screens. And the proctors, the staff who are administering it, simply proctor really by making sure that people aren't watching each other's screens. And they proctor by making sure that people have the correct login information, and they are discouraged even from positioning themselves in a way where they might even accidentally see any information on a student screen. So students may opt out and families may opt out, and opt-out can happen in a number of ways, and I think that's one of the very important things, because we recognize that the material that's on here is of a sensitive nature, and some families may choose for their child to not participate in that, and we completely respect and understand that perspective. And so families can opt out, and we aggressively push out that information through multiple channels, through direct emails, through school messenger, as well as through the middle and high school websites. And then individual students may opt out by just choosing not to participate, and they're provided with an unobtrusive activity to complete on their computer so that nobody knows they're opting out. So it doesn't stigmatize opt-out in any way. There's no moment where, okay, everyone who's not taking part in the test, get up and walk out of the room and be looked at. It's a very confidential sort of a process. Proctors are made aware of students whose parents have opted them out so that they have that opportunity. But students can make the choice to also discontinue taking the survey at any point, skip questions, and we remind students of that. In fact, it's very important that students know that they can do that. We found that nationally, when studies have been done on the YRBS, that the three biggest things really that contribute to students participating honestly is A, understanding that their contribution is valuable, that the local district and other organizations are trying to use that data for the betterment of the programming. Number two, that they really do have confidentiality and we're not somehow secretly logging their keystrokes or anything nefarious. And number three, knowing that they have control and choice and the ability to opt out if they're uncomfortable with the phrasing of any item or with any particular category of questions on it. And that's super important to this being an effective survey. It was not administered, as Mike mentioned, due to COVID in the 2019-20 school year or the 2020-21 school year, and that's a mouthful to say altogether. So we've gone a couple of years without this data, and so that's why we believe it's important to reinitiate the process of obtaining this data so that we know where we are. One of the things that is also worth noting is after this year, DPI will switch us back to a spring administration. So we're getting back to our regular rhythm of gathering data of where our students are in the spring. I suppose an argument could be made that how students feel in November may be a little different than how they feel in May. I know I'm feeling different about the school year in May than I am in November, perhaps. So we'll get back to that regular rhythm, and DPI will get back to that regular rhythm in the next administration, which will be in 2 school years. It's also worth noting that there will be 2 new questions added in this administration of the test related to COVID impact, just simply to determine how closely our students have been affected by that. And the questions are simply whether they or a household member have lost a job due to COVID, and whether they or a household member have been seriously ill as defined by an overnight stay in the hospital for 1 night or more due to COVID. So this will be a mechanism that we see how the county's been affected and how the students are processing COVID data. And I think it's important also just to see how our kids are doing in general and how our youth are doing. We know that it's been a challenging couple of years for students for any number of reasons. I've provided links for the board to have access to the full questionnaire here as it exists in the 2021 version. So, those who are real fans of the survey and really closely monitored might see some slight wording differences in some things, but it's pretty well the same content that we've seen. I would also point to the fact that because in many states marijuana is no longer an illegal drug, that has been taken away from some of the questions on illegal drugs. So that wording, because this is a national instrument, may look a little bit different in terms of what items are listed, and marijuana is treated separately from those other categories just because we're not in the same place across the nation in terms of what is an illegal drug and what's not, and what's conceptualized as an illegal drug. So the parent communication plan will be as it's always been, and that's multi-channel communication using messenger, email, building web pages. Weeks before the survey is administered in multiple rounds of communication. And I've included a sample letter of past years, parent letter, which includes an opt-out form at the bottom that can physically be returned. There's a phone number that parents can call to opt out via phone. And of course, as I mentioned, students have the opportunity to opt out, as well as a fact question. And I simply attached the Asa Clark Middle School version of it. They're parallel forms, really, for the Asa Clark form in the high school in terms of the frequently asked questions information. So those are the materials that we have and will continue to provide parents before the survey so that they have an opportunity to look at the survey, consider the survey, and make choices regarding opting out as well. And within that, that sample letter is a link to the information with the questionnaire as well. So those are published, and again, those are published on DPI's website as well for everyone's consumption. So that's kind of where we are with the youth risk behavior, some of the changes that have come about in the last couple of years. And I thank you for hearing me out, and I welcome any questions or comments or discussion from the board at this time. Yes?
In the past, what was the opt-out rate? Do you have like a percentage or general?
I can't tell you a specific number. I would say it hovers probably around 10%-ish. It's a higher percentage for lower grades, understandably. We have now voluntary opting out. I can tell you that when we've conducted it first thing in the morning, our seniors tend to opt out at a pretty high rate when we do it in May. So we've had voluntary opting out and non-participation at higher rates from our students who drive themselves to school as well. So we're aware of that and hopefully messaging to them the importance of their participation in it. I suspect that's a very different sort of an opt-out, though, in that situation.
And is there a trend as to which questions they stop answering?
No, I think, I would say categorically the questions about sexuality and would be probably and sexual activity would be the ones that are most skipped and stopped on. And those tend to be towards the end of the questionnaires as well. And I suppose to some degree, it's hard to tell whether someone ran out of time, but my suspicion is that those being uncomfortable questions don't get answered, and that's okay. We want people to answer the questions that they're comfortable with. Everyone's pretty liberal with their providing us with information as to whether they're eating vegetables, getting enough sleep, and wearing bike helmets. So, yes.
With regards to the removal of the exclusion of marijuana, will you talk to the students about why that's being removed? You know what I mean? I mean, I would assume the high schoolers will figure it out.
Yeah, there are still some questions, and the verbiage is just pretty
Well, it basically says drugs,
nuanced.
and it lists drugs. And
Yes,
says
and
except
it
marijuana
excludes, right.
in bold.
Right. And so we'll definitely talk about why that's the case, that this is not the school, DPI, or National Institutes of Health or anyone else endorsing marijuana by including that statement, but there are just different legalities in different jurisdictions. Yes?
David, two questions.
Sure.
So the middle school students take this during PE or health, I saw in the memo.
Yes.
When do the high school students take it?
High school students have taken it during their resource time, which is like the homeroom at the beginning of the day.
Got it. Okay.
So,
And since it's being done in the fall, will we see results from you back with us in the springtime sometime?
yeah, sadly, DPI is not super swift with their results. They've told us late spring, and that's as specific as DPI's website has been. As they've gotten their systems newer and more efficient, it's somehow taken longer. But they're saying late spring. Historically, what we've done this survey, I think for the first several administrations, we had a pretty open window through the spring semester. We would conduct it in May, and we'd get our results in early July, late June. they pushed a window earlier into February, March window in the last administration. We still got the results at about the same time. I suspect that when they say late spring, that means not spring semester, but late seasonal spring. That's my hope, that we, will have some information and data as we roll into the later spring months of April and May. But I'm not making any promises on behalf of how DPI will process its data and make its information available beyond what they've already told us.
And since it's done by age,
Yes.
do we track cohorts like we do with?
Yeah, to some extent, we
academic?
definitely look at how different cohorts are moving through. Now, it's been challenging. If we're looking at current information, we've lost meaningful data on a whole big cohort of students by not administering this for a few years with the gap. And DPI has switched to an every other year administration too, which makes it a little hard to track cohorts because, if I get data on 8th graders, by the next time I gather data on them, some of these are, kids with driver's licenses and jobs, and that's a whole different dynamic with a lot of the things that we're looking at.
Okay.
I wish that we could gather data annually to track it like we used to, honestly. But DPI has made that choice to trim down the efforts and just put a little less resources by doing it every other year, and that meets DPI's purposes, and therefore that's what they support.
Okay. Thank you for your answers.
You bet.
I
Larry?
have maybe a two-part kind of question.
Sure.
Actually, two questions, but two different kind of responses that I'm looking for. So what does the district do with the results? And then what does the DPI do with them and the federal government? And I'm looking for just a real short, brief answer of how we take the results and maybe change programming or change
Sure.
curriculums or something.
Yeah, and I cited some examples, like some of the programming that we provided for families and parents. I would even look at staff development. Brian, I'm going to throw Brian out there as an example. Brian Sniff in our staff development at the high school this year shared out some numbers about sleep, screen time, breakfast in the morning, some of those things that may walk in with students to homeroom. So right down to information just to share with homeroom teachers about how to coach up some real basic habits and behaviors that will affect someone's school day performance, as well as this data is shared with the teams for the health curriculum, as well as the guidance department as they develop their curriculum. So that's kind of the short answer. Is that sufficient for how we use it?
When we started establishing like the social or the counselors, outside counselors?
Yep.
Did this data?
Yeah, definitely. I think a lot of folks were maybe a little surprised to find that about 18 to 20% of our high school students had reported feeling so sad, helpless, and hopeless within the last year that they had stopped engaging in normal activities, and that 8% had seriously considered suicide. That was startling data for a lot of folks, and pointed to a need for easier access to social emotional support and clinical services. We also, coupled with that, we were seeing wait times creep up to 2 months, 3 months for some folks to get in to see some agencies. So this was combined with other points of data to highlight that need for access to services. And the same thing, some of our substance prevention services as well. And in the national and state data, I think it's used largely at the state level to justify and look at grant funding for a lot of health and wellness programming. It's used at comparison data to see how various counties are doing. They'll only look at county data if 50% of students in a county at a particular building level for that purpose are surveyed. And right now, Waukesha County has not been at that 50% threshold. And then at the federal level, again, just as points of data to look at prevention services and other things. The big highlight I would point to is vaping and how, looking at that trend. We celebrated for the longest time how well we were doing in reduction of tobacco use. We went from in the 20s in terms of percentages when I was in high school. And I guess that ages me a little bit and identifies, if you know the data, how old I am now. But we were kind of celebrating, hey, we've got this down to 9, 10, 11% in some areas. but without realizing that part of that was being skimmed by vaping. And so looking at that skyrocketing. So, information like that is very helpful for everyone, I think, in developing how they're reacting, how they're pushing out public education and information as well.
And you maybe partially answered my question in terms of what other districts in the Waukesha County or area administer the survey, but you said we don't get 50%.
Yeah, I know that, and again, I can't tell you who's currently, because it's ebbed and flowed. I know at some times that Oconomowoc has used it. I know Waukesha has sometimes used it. I know Elmbrook has toyed around with it, and I'm not sure whether they're currently using it this year or not. I'll be anxious to see. I think there are a lot of districts that are looking to capture data coming out of the pandemic to see how their students are doing. And this is a good survey, some of the questions particularly that relate to depression and anxiety and some of those things. So I'll be anxious to see where some of our neighboring districts are with it as we roll into this administration. And unfortunately, DPI hasn't put out a list for everyone to see who's on, and there's kind of two sorts of districts that are used. Some are considered a sample survey district where they just conduct it differently, and some are considered voluntary districts. We'd be considered voluntary. And only information on sample survey districts, and that list is available to them. So we're just kind of waiting and seeing who around us is doing it to get that information. I wish I knew more.
Yeah, just that comment on that, because I work in a healthcare setting, and the county health departments, like in Washington County and
Yeah.
Ozaukee County, basically have kind of like suggested to all of the school districts, and I think they have
Yeah.
100% participation.
We have had some of the county organizations as well as, and not just the county itself, but some of the coalitions for youth mental health and substance abuse within the county have begged school districts to please consider conducting it, particularly for some of the substance use and prevention data, so that they could get that county data.
Thank you, David.
Yep, you bet.
No, I just was gonna say, I'm disappointed that we're not getting our results back so late, because I would hope that we would get lots of good information, especially in the mental health issues after the pandemic, as how the kids did last year and the year before.
Yeah, I agree, and I suppose the good news there is, we probably have the ability to, in other ways that we ask questionnaires, to ask parallel forms of similar questions in a smaller sample survey. And I know that, we've sent out, checks from the counseling department to students during the pandemic with how they're doing, into families regarding how they're doing with some of our internal surveys. And so maybe a point to consider, Jean, to your point, is that we might be able to gather some of this data quickly by asking targeted questions ourselves.
Any questions? Thank you, David. Appreciate it.
I appreciate your time. Thank you.
David.
Good night.
Yeah, Fred deserves it, yeah. All right, next item on the agenda is the discussion and possible adoption of the strategic plan. So I'm gonna turn it over to Mike.
Yeah, I'll just kind of move into questions here pretty quickly. Just a review. Last spring, we engaged in our strategic planning process. Just a reminder that we just closed out a 3-year strategic plan. We plan in 3-year increments. And so this is a new 3-year plan to go from 2021 through 2024. Just to kind of reflect on our process, last spring, we had more than 700 stakeholders from community members, parents, students, staff members, all participate in this process, from surveys to focus groups. You'll recall our Saturday retreat, where we spent quite a bit of time going through that feedback from our stakeholder groups, our community, as we talked about what strategic initiatives we would want to embrace to continue to advance our mission of opening the door to each child's future. What we've done is we retooled the framework, and that's a part of what's in your packet, is that kind of that model or that framework for strategic planning. Going back to our experience with the Baldrige Excellence Continuous Improvement Model, when we've done our organizational profile, we really defined the operations of this school system in two major categories, teaching and learning and operations. And I remember always Dr. Sternke, when she would present on this, talking about the two sides of the schoolhouse, and that you had operations, and the goal of operations was to be as efficient as possible so that more resources could be funneled into teaching and learning, which is our core business, the learning of students. So we've designed this for tighter integration than maybe we've had in past plans around these kind of overarching district commitments, which fall under teaching and learning, that future-ready commitment about engaging each student in innovative, authentic, and highly relevant learning experiences to provide them the knowledge, skills, and social-emotional readiness required for our graduates to succeed and thrive in their future. And then that falls under Danielle as the overarching process owner. And then, of course, under operations, it's sustainability. And so we commit to continuously engage in disciplined, innovative, and proactive planning to ensure that our district provides high-quality facilities, resources, and services for students, staff, and our community. So how do we sustain and continue to grow the resources that we have for our students? And so then, as you know, we're organized around 6 core work systems, and this is a nuanced change from in the past. So in the past, we would have strategic goals really from these 6 areas, and it made sense to us to kind of organize it and integrate it so that each core work system has specific goals related to both future-ready and to sustainability. So you can see there the goal statements from all 6 departments. As in the past, these goals will be supported through fully developed Plan, Do, Study, Act style action plans that will include 1-year tactical plans with 1-year increments in terms of the metrics that are used to gauge progress. We'll continue to engage in 90-day cycles of improvement as an administrative team around these goals. These goals cascade through all levels of the organization. So the school level improvement goals, they take their lead off of the district goals that are selected and approved by the board through the strategic plan, and then on to teachers and the teachers in the classroom through our educator effectiveness evaluation process. They establish professional practice goals and student learning outcomes that are guided as well by their building goals, which of course come in some part from the strategic plan. So that tight integration in the system so that we're pulling in the same direction. And so you have these materials to look at. I know you were all deeply involved in the process last spring. And so would be happy to take any questions. Our department heads, our process owners for each of those 6 work systems are here to answer questions as well if you have specifics for them. Or I'd be happy to answer your questions as well.
Let's start, Steve. Yeah.
Danielle, my first question will be for you. Are we anticipating going back to sort of pre-COVID observational strategies for the teaching and learning objective measurements that you mentioned?
As far as teacher evaluation and observations go?
Yeah, I mean,
Yeah.
I participated in the past in some of those in-classroom observations where we go in and look for,
Yep.
as you describe it, evidence in the classroom, artifacts,
Yep,
right?
yeah.
Is that what you're thinking? Is we're gonna go back to that strategy and have a leadership crew going into the classroom to make those kinds of observations?
Yes, so last year we were still able to continue with the principals going into classrooms and doing their observations. And towards the end of the year, we were able to begin again our learning walks that we had done. We were only able to get in, Mike, correct me if I'm wrong, I think maybe each school once.
Yeah, I think that's correct.
Yeah, you know, because we started that up late in the spring. So yes, learning walks will once again happen, as well as Robin and I have committed to being in 178 classes in 178 days. So each week we're making sure that we get into the same number of classrooms that we have in the days of the week. So if we have 5 days of school this week, we'll get into 5 classrooms, and her and I are doing that together, not so much from an evaluative standpoint at all, but rather so that we can keep seeing what's happening in the classrooms, and continuing to watch what's happening, because, we weren't able to be in classes as much as we wanted to be in the last year. So far, so good. We're 7 days down.
Excellent, thank you.
That's good. I think my question is for you, Danielle. Are there any particular strands of our graduate profile that we are concentrating on in the next couple of years?
We're certainly concentrating on all of them, and, we're in full implementation of all 6 of them. We're focusing a lot this year on continuing to improve assessment practices and have assessments be more authentic and relevant. So those very naturally are connected to the contribute and the connect category of the graduate profile. But the compete category remains a high priority, as well as you see in the individual goals about making sure that we're continuing to excel academically and also close those, any achievement gaps that we may identify.
Larry?
No, I'm done, thanks.
Steve?
Good.
Stacy?
My only question related to the workforce development, the district will increase the diversity of the staff each year until it matches or exceeds the diversity of the student population through the implementation of recruitment and retention strategies. Just to clarify, we know our populations, we're just trying to make the staff more diverse, but it's not about matching ethnicities, right?
Yeah, correct. So I'm just going to pull this down so it's easier to hear. So the goal is to diversify the staff. It's not that we're going to have, a 1-to-1 ratio of this ethnicity. It's that we want our students, and believe it's important that our students see themselves reflected in the people that work with them. And, our student population is substantially more diverse than our staff. And the key here is that the goal is driven by strong recruitment and retention practices so that we can recruit very high-quality candidates. I did have a question. I talked about this with one of the focus groups, and, are we still hiring the most qualified, best people? And certainly that is the intention. And so if you have, and Colin's working diligently on really trying to recruit high-quality, diverse candidates, so that is the goal, to have students see themselves reflected in the staff that they work with, and to continue to hire a world-class, high-quality staff at the same time. It's not easy. It's a challenging goal.
For sure.
But I think it's an important one.
Yeah?
I'm good, thank you.
I'm going from John, being the gearhead I am. You and Stangler have done a great job in reducing the energy profiles for all our buildings. So, you got any other tricks up your sleeve, like stealing solar panels or something like that, or?
There's continuous opportunities that we'll look for, and looking at what's happening in industry and what's happening in other districts, not just within the public education sector, but across other businesses. See where there's opportunities and then evaluate them for, do they make sense for us? Measure payback and look at, what makes the most sense, where we can save money but have it be sustainable and change the operation.
So now you're not gonna show your cards?
No.
Okay, got it, okay. Anything else? All right, if people are comfortable with this, we could use a motion to accept this as their strategic plan for the next 3-year period.
Move to approve the strategic plan as presented for the 2021-22 year.
Second.
All in favor, signal by saying aye.
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 6-0, carries unanimously. Thank you. Thank you.
Yeah, thank you, and thank you all for your participation throughout the spring. So now with the approval, the process owners will, work to detail out those PDSA plans, and we'll be providing those to you in the months ahead so you can see more detail on the specific actions.
Let's move down to a vehicle lease proposal. We're getting rid of the old ones, huh?
So tonight you have a proposal with the pupil transportation plan that we have within the district. It ranges all the way from using third-party carriers, like Rightway, our current partner for regular student transportation and special ed transportation, to some owned vehicles when it makes sense to own those vehicles, and then some leased vehicles where it gives us a flexibility over time to meet the needs and the demands of the student body. So as we create opportunities, sometimes those opportunities are smaller participation. So we get these vehicles that hold the 8 passengers where we can transport the students within the district. We have 3 vans currently that are coming off of lease. 2 of them will be replaced through this action tonight. The 3rd one we're keeping just as a stopgap until we can, till that can be replaced. The vehicle that was on order is delayed. So these 2, we utilize a state contract for purchasing. When we look at the base pricing model for these leases, so we piggyback the state contract that Wisconsin uses for purchasing their vehicles as the basis for the lease cost.
So the lack of the 3rd vehicle due to like the chip shortage, or what, it's a dealer?
Just delay in building it. It's a wheelchair accessible van.
Oh, okay, all right, that makes sense. All right. Questions for John?
Maybe just, John, one quick question relative to the cost savings. I mean, if we go with the state plan, which obviously makes sense, I mean, how much are we saving by doing that?
It's about 20 to 25% off manufacturer's list price is the discount that comes through the state contract. We talked earlier about co-curricular transportation a little bit. These vans that we have and the vehicles that we have been instrumental in meeting the needs of our student body when there are not drivers available or other vehicles available to be able to get them to events. So the 4 vans that we have total right now, using for co-curriculars, are out every night of the week.
Any other questions for John? If not, I'll look for a motion.
Recommend the approval of the lease with Ewald Fleet Solutions LLC for 2 Chevy Traverse all-wheel drive vehicles for a term of 4 years at a rate of $331.23 per month.
Second.
Thank you. All in favor, signal by saying aye.
Aye.
All opposed? 6-0. Start a school report. I'm going to turn it over to Dr. Katie.
All right, thank you. I don't have a tremendous amount here, really just some compliments. I think we had our first Monday of the year today, so we survived our first Monday after 2 weeks without a Monday. So into our 3rd week, things are going very smoothly. I want to compliment our principals and their staffs for the great job that they're doing. Walking through the building, kids are engaged. I just feel like we're off to a very positive and successful start. So the staff has done a great job. And it's been a really good few weeks. I'll certainly talk a little bit more with my update on COVID planning when we get to that part of the agenda. That's went pretty well so far. Rates have been very manageable to date. We hope that continues. So we're glad that we've been able to function as well as we have. I'd be happy to take any questions that you have, but it's been a very, very good and smooth start to the school year.
Do we have enough bus drivers? We're doing good on bus routes?
Yeah, it's a good question. We're really blessed in that we do have drivers staffing all of our routes. There's a number of districts around us that do not, where drivers are having to run double and in some cases triple routes to get kids to school or to get them home from school. So we are staffed. We run into pinches really with the co-curriculars and the after-school pieces. John talked a little bit about that with the vehicle lease component. That those supplement our ability to get students to their extracurriculars, but we're fortunate that we are staffed for our regular routes.
Anything else? All right, well, thank you for that. Knock wood, we get a smooth start, so. That takes us down to personnel issues, which doesn't look like we have much of anything there. No resignations?
No resignations, no employments, no leave requests at this time.
Fantastic. All right, going down to board goals and operations, we got some upcoming activities. The 27th, you might have seen this on there for a closed session with a meeting with legal counsel at 6, and then the regular meetings after that. At 6 o'clock will be closed up in the library here in this building. Homecoming, October 8th. I'm sure it'll be beautiful and sunshining there. is there gonna be a parade this year?
I believe we're planning for a parade, Mr. Sniff, yes?
All right,
Yep, big nod over there, so that'll be great.
fantastic. October 11th, Business Affairs and the regular meeting, and then Tuesday, there's a regional meeting for WASB. I cannot attend. Who else is planning on making that?
I'm one.
Okay, wave over to Julie.
Jeannie, Larry, Steve, so they're going as well. Stacy.
Okay.
I'll be attending as well, so I'll see you all there.
All right. 25th, we got a policy meeting. Policy is meeting, what, every other month now, Jeannie?
Yes.
Okay, all right. And then Business Affairs the 8th, and then we have the one meeting at 7, the week of Thanksgiving, so that takes us out pretty far. Larry, anything to add to the School Alliance calendar?
That's what,
SWSA.
SWSA, yeah.
no, other than we have a meeting tomorrow morning, which is our normal monthly meeting for that, so encourage anyone who wants to attend, sit in on that, that's great. I think we have a couple guest speakers tomorrow in terms of, again, speaking in terms of different topics that are out there, so.
All right. Well, I'm gonna keep it with you, Larry, because underneath that is goals of discussion.
Yes, as, I think it was either July or early August, we had some discussions regarding the board and superintendent goals. And Steve and I have not actually been able to meet, and with Daisha stepping down from the board, I'm hoping that we could get someone else who would be interested in joining Steve and I to do that. So potentially Brian would be willing to join us. And typically, we go through and look at what we had as board goals last year. We look at also the status and the updates in terms that Mike provides with board and superintendent goals, and then also try to incorporate in, which was just the approved plan tonight for the strategic plan, to identify any things where we have some board learning sessions that we want to accomplish and or address some of the things that were out there. And I know one of the ones that we've talked about frequently is the potential to address the student achievement that over the last year and a half or so, how that has been affected, and making sure that we cover some of those kinds of topics as well. Other than that, I think, again, Steve and I will now be able to, and Brian will include you in our discussion work group on that to kind of go through and revise and revamp the current goals. But the one which always stays is the number one, which is the focus on the strategic plan as we go forward, so.
You anticipating a Saturday morning or something? What are you anticipating?
Well, we'll have to decide if that works for
Figure
your
out something that
schedule.
works for everybody, yeah.
Yeah,
Yep.
well, just between me and you, we gotta get Larry to buy, you know.
Oh,
Yeah,
got it,
yeah,
got it,
yeah.
got it.
No, I do. We'll buy, so. So yeah, if we want to set it up this Saturday, we might be able, if that works for people's schedules, we could do that, so.
All right, thank you, Larry. Vacancy update for the board.
Yeah, in your packets, the materials are there, so Julie, I'd like to acknowledge her for the work that she's done, so just to kind of review the timeline of pieces. The notices were published in the newspaper and on the district website, September 3rd and 10th. September 3rd, the declaration of interest packets were made available, and we've had a couple of those come in. Miranda's done a nice job pushing this out on social media, Facebook, and others as well to get the word out. We did send a school messenger out to the entire school community on September 7th. We will be resending on September 20th, and the packets are due at noon on September 29th, which is actually my daughter's birthday, oddly enough. But September 29th at noon, declaration of interest packets will all be in. And then one of the things that we have to do is solidify when the board is going to conduct the interviews, tentatively scheduled for the week of October 11th to conduct interviews with the candidates. And we've just got a placeholder there, 6 p.m. At Pewaukee High School on the 11th. And so that's something that maybe we really want to nail down probably by the next board meeting to make sure that we have that firm. Week of October 18th then is the plan for the board to appoint the new member. And then October 25th, the new board member would be sworn in at that meeting and begin serving on the board. So just a review there of the timeline. We're making good progress. I think the communication's been strong, and we would certainly be happy to take any questions that you have on the process.
I like the fact that we've got the applications on the shared drive. That's really helpful to have those up. So thank you, Julie, for facilitating that.
Let's go down to legislative discussion. Anybody heard any updates of late?
No, things are kind of in a
Holding pattern?
state of flux right now a little bit, I think. I don't think there's that hot topics that I'm aware of out there, but.
Yeah, I guess the one, just because we had YRBS tonight, I just point out there is, and I haven't heard if there's been any recent movement, but I think it's, Mark Klein has proposed a smoking ordinance, and that would affect vaping and those kinds of things. So that's kind of interesting to see what might happen there. Looking at raising the age to, I believe, 21 for tobacco and nicotine products. I do know that, we've seen the vaping in particular to be a real issue with our students. So it's good to see the state at least taking some real strong interest in this and looking at opportunities to maybe offset that for our ability to manage that with students. So that's one piece that's out there. There are, of course, some budgetary pieces. John and I were talking this morning, the governor has a piece with some discretionary funds from federal dollars that it's unclear as to how that's going to be allocated, and that has some impact on our budget planning. So those are a couple of pieces that we're watching. This SWSA meeting tomorrow morning always includes legislative updates. So it'll be interesting. Larry and I will both be on that call. And of course, as he said, you're all welcome to join. See if there's some new movement in those areas.
Okay. Let's take us down to then the update on our COVID situation.
Yeah, so I just sent the board just kind of a tentative update for the week. The problem is that the DHS has not updated the data on the website. It's only through Friday. We hope what we saw there continues. So things are going pretty well. The last days of last week would have actually had us drop down to the green category in our model as the 7-day rate dropped last week. So that's encouraging to see. The transmission, which is another measure in the community, which is cases by, per 100,000 population. We had dropped from high to substantial at the end of last week. But we don't know what happened over the weekend, and we don't know what happened today on those pieces. We did see an uptick in student quarantines from last week. We jumped up to 54 students in the district that are out, and we had 6 positive cases. Currently have 1 staff member out. So that's something that we're watching. So not super surprising, but we saw some increase internally, but really from a historical perspective, relatively low at this point. So we hope that very much hope that continues. So as I kind of said in my message that I sent out late today, as we kept refreshing the website, usually it's updated by 2 o'clock, and they just never updated it today. We'd have a better picture, so I need to see what it looks like tomorrow. So I would anticipate us being either green or yellow, which is where we've been in terms of that. So that's good to see that continuing. In addition, I would say vaccine rates are good and continue to go up, which is helpful as one of the mitigation protocols as well. But I'd be happy to take any questions that you have. So right now it's been pretty calm, but we want to keep an eye on some of that uptick in what we saw. Had a number of calls come in this morning with some people having symptoms and those things, but there's a lot of viruses going around right now as well. There's a little flu, there's this respiratory RVS or RS something that's going around. Yeah, RSV that's going around. So there are some other pieces, not to mention a really bad allergy season. So all those things can look like viral pieces too.
Any questions for Mike?
I have a question.
Nope. Going to look the other way.
One of the things that, I think we all need to be very concerned about is making sure that while we have some students who opt to wear masks and some students who don't, that we have mutual respect for each other's choices. I wanted to hear from you any concerns being expressed by parents, students, administrators, building staff about, amongst the kids or amongst staff members, about any concerns with bullying or unfriendly behaviors.
Yeah, and that's something that we emphasized with the launch of our plan, that was a piece that we were going to be vigilant about. I have not heard about incidents of bullying for wearing masks or not wearing masks in my, I walk around our buildings every day. I think, the kids seem to, some wear them, some don't, in most cases, and it seems to be just kind of the way things are, It almost feels like, I thought the other day, it's like when you go to the grocery store. Some people are wearing them, some people aren't. It's people's personal business, and we hope that that continues. There may have been incidents that I don't know of, but I haven't heard of issues.
Okay. Any feedback from the staff about feeling pressured in either direction?
No, haven't heard any. We have some staff that some choose to wear it, some choose not to. And I haven't had any staff reach out to me with those concerns. And I haven't heard from principals that staff have, and, I have a couple, Brian shaking his head over there, that we've had those concerns from staff.
I hope that continues.
Yeah.
Thanks.
Mike, we don't have any more virtual teachers. If the kids are out on quarantine, do they just Zoom into their classroom then?
Yeah, good question. So we have, as it's in our plan, if students are home for quarantine or for isolation because they're COVID positive or probable, we provide what we call emergency remote learning. And so that includes the ability to be online and to have the Zoom meetings and those pieces as a component of that. So, the high school did a really good job as an example of that last year with that synchronous teaching. So some students would be on the video call, some students would be in the classroom, so it's more like that this year. It's more of an adjustment for our elementaries because last year we did have specific virtual sections, and so when a student would be out for any period of time, that student would be placed temporarily into a virtual section for the teacher to manage. But this year, because we don't have any purely virtual sections, those teachers in the other buildings are doing it very much like the high school did last year, which is we're teaching the kids in front of us and we're providing instruction to the kids at home using, again, things like Zoom or Google Meet, along with Canvas for the older students or Seesaw as our learning management systems as well.
Stacey?
So since our last meeting, I've been wrestling with our, the screening, the weekly screening for the non-unvaccinated staff. I get the concept, but I don't agree, A, that it's brings us to a level of effectiveness that I think is worth it. We know that there are breakthrough cases for those who are vaccinated. We know that people that have been infected and have carry natural immunities are still not counted as being immune. And I just really struggle with this. And so I've been wrestling with it for, has it been 2 weeks, however long it's been. And then we got that email today from the teacher that raised that same issue. And I go back to that we trust the professionalism of our staff, that they will do what is needed to keep their students safe.
Well, a couple of things I would say, and just to give you more food for thought. One, the data, and I can share with you the page on the DHS site, but one, previously infected, it is 90 days where they have no different status than someone who's vaccinated. So if someone's had a confirmed COVID infection in the past 90 days, it's the same status. I brought this question up at our county health meeting last week, if there's any movement or change. I was told that no, there hasn't been, but they said they know it's being studied in terms of length of time. I've heard, will it be moved to 10 months, those kinds of things. But right now, that's the guidance that we have in terms of previous infection, because I would agree, I think that's something that I would hope is being studied and looked at more closely in terms of rates of reinfection, those kinds of things. So that is a piece that's in there, and we're leveraging that to the greatest extent that we currently can based on the guidance that's out there. The other piece is the data shows that people who are unvaccinated, the rates of infection are more than triple that of those who are vaccinated. So the risks to that a staff member who's not vaccinated could be carrying COVID and potentially infecting colleagues or students is greater. So that's the idea of the screen testing. Also, we don't want vaccine requirements. So this is like an alternative to have a screen testing piece to help offset the safety piece, try to keep our kids as safe as possible, have it available on site, to try to do it in a way that's as convenient and as simple for the staff as possible, and just provide a layer. Because we know there is no mitigation that is 100%, whether it be a vaccine, a mask, testing, none of those things are 100%. It's about, the sanitation, ventilation, all that. It's when you layer stuff together that you have the best situation in place. So I do want to compliment our nurses and Colin, who's done a lot of that work. We are really up and running with testing. I know we had a staff member wasn't feeling so well today, went in, got tested because we have that available, and that was, of course, voluntary. I know that's not where you were going with this, Stacy, but the capacity is there. So the reason for that is really a practical one, to say that people in that category do have higher risk. So trying to balance those things in terms of that protocol being in place. But it is based on the data about triple in terms of the rates of infection of unvaccinated.
Mike,
Yeah.
question on that. If I'm reading the chart properly, only weekly screening is required when we're at the orange level or
Correct.
above.
Yep.
So we're not even doing it right now as a requirement, it's recommended,
It's encouraged.
encouraged at yellow level?
Yes. So it's available at
Okay.
green. It's word applesauce here, I guess. So
Yeah, yeah.
It's encouraged at green. It's
Yep.
recommended at yellow.
Yep.
Or no, it's available at green. It's recommended or encouraged at yellow, and then it's required
At orange.
weekly at orange. Right, correct.
Okay, all right, thanks.
So we haven't hit that level yet.
We haven't hit that, right?
We're not going to. We're just gonna smooth sailing all year. It's gonna go to green, and we're just gonna stay there, so.
I'm as optimistic as a person that lives, and that's not what I expect, so, just. put it
Please,
out
that'd be
there.
great.
Anything else? I'll ask if there's any citizen comments to bring a card down to Julie. Just the one?
You want to reference it? I think we know you, Charlie.
Thanks. Hey, it's not bad to know. Okay, so I have 3 questions. Number 1, does the school have an access code for the WIR website? Question number 2, are applicants applying for the school board? Are there applications like a matter of public record? Will we be able to see? Question number 3, will the interviews be public? Boom, those are my questions.
You're talking about the immunization registration, WIR?
Yes.
Yeah. The nurses have access to that as medical professionals. Colin, do you have anything you want to add to that the nurses have access? So our nurses do have access to that. So for question 1. 2, the list of candidates will be published when we do the interviews.
Okay.
So like in board packet materials.
So like, would that go like before the October 11th?
That's the tentative date.
Whatever date
So when
that
that
was.
comes, you'd see the candidates who are in there. I'm sorry, the question 3 was?
Will those interviews of those applicants
Yes.
be public?
Yes.
Okay.
The interviews and the deliberations are in open session. Yep. Okay.
All right.
Welcome, Katie.
Hi, everybody. I'm Katie Segalowski, as you probably are aware. Just wanted to follow up on the strategic plan 21, years 21 through 23. How do you identify achievement gaps? Question 2 is there a new strategy to identify the gaps, or is it the same one that you've used in prior years? And I know, Danielle, we have a follow-up to do once the results are in from last year.
Danielle,
So-
you want to speak to
Yes.
that?
Yeah, so we look at the achievement gaps through a couple of different ways. The first is through our standardized test results, and so those identify that and give us a breakdown demographically. Our state report cards, when those get published publicly, would show where those gaps may be. if they exist. We also take a look at our internal assessment data, such as STAR progress monitoring, because we can do that more regularly, and we have the data in real time. So that is, we also use like Fontes and Pinnell and some of those other internal assessments, and then we also look at course proficiency, and so students' performance in their classrooms as well, and take a look at that. And so we're working right now with all of that data, and again, because some of it is embargoed and not public, we can't publicly state it, but we're working right now to identify those pieces.
So is that the same as it's always been? And have we looked at maybe trying to look at things or adding different ways of looking at the data to try and get ahead of trends before we're behind?
Yeah, so we have always looked at standardized assessments, right? That's the most typical way.
Right.
We have increased our use of the internal assessment data as well as course proficiency. So I would say that those have seen an increase in use as that. And we're also following trends in some of our programming, like specifically alternate education at the high school. While sometimes those are students that we receive from other districts, very often that's the case, but if we're seeing any type of change in our need for intervention students as well. So we're watching those trends also.
Danielle, could you maybe touch on, in our RTI process, how we use assessments to identify students that might need intervention, because that might speak maybe a little bit to what Katie's asking as well.
So our RTI process, and I'd be happy to share with you our RTI handbook, that's public knowledge as far as how we identify students in need of intervention. It looks at a tiered approach, and so as students start to hit certain thresholds, both on standardized tests as well as, again, those internal progress monitoring assessments, we identify those students and then start to provide intervention services and then progress monitor them weekly or every other week, depending on their need, to identify if they're moving forward or if they need additional services. And so that can range all the way from some small group instruction a few times a week to intensive one-on-one instruction almost every day of the week, depending on the student need and what we see as changes.
Okay.
But I'd be glad to share that with you.
Okay, all right, thank you.
Thank you, Katie.
Danielle, would you mind just explaining what STAR progress monitoring is?
Yeah, so STAR is an assessment. It's from Renaissance Learning. So STAR and MAP are maybe the ones that you'll hear about the most. We used to administer MAP and stuff, and we've switched to STAR. So it's just a different company that administers this assessment in both reading and in math. And so it changes as students answer correctly or incorrectly to eventually get them to a level that shows where they're at as far as like a grade level comparison. So it lets them know if they're on track, above grade level, below grade level. And it's sensitive enough that they can take it up to weekly, and it's fairly short, so then we can kind of watch and see. And it also then identifies specific standards or target areas that they need to improve on. So teachers can do groupings of students that maybe need to work on a particular area, or they know how to change instruction for that particular student.
Is there a requirement of how often teachers use that tool?
It's used as a universal screener, so it needs to be given twice a year in grades 1 through 8. But if it's being used for other instructional purposes like intervention, it can be used as regularly as weekly. Some of our grades have chosen to use it monthly. Most of them use it monthly. It's pretty short, it takes about 10 minutes. So they use it monthly because then they can track that students are making 1 year's growth in 1 year's time. We set goals and can monitor who's on track to make a year's growth in a year's time, which is what you would expect a student to do.
And are the results immediate?
Yeah, they receive the results immediately. Yep, and students can see their results as well.
Thank you.
I have a question for Danielle too. So two things, when you talk to the RTI, is there like a grade level where that starts? And then how are the parents either informed or made aware of the RTI components?
So RTI can start as early as kindergarten. Typically, you need to see some historical data, some trend data that a student maybe isn't performing where we want them to perform. And with our littlest learners, that can both take some time. We don't want to early identify and just have it be because the child hasn't developmentally quite got there yet, but kids change so rapidly when they're so little. So it can start in kindergarten, but it usually starts to pick up more so in first and second grade. It goes all the way through 12th grade. And when a student is identified, then yeah, the parents are notified either by the regular classroom teacher or by one of our interventionists or one of our school counselors or psychologists, depending on the school. It depends on who connects with the parents. And those parents then come in or meet with the RTI team to help develop the plan, so the parents are aware of that, and then they get communication minimally every 6 weeks, but sometimes, and oftentimes more regularly than that as far as how their child is doing in intervention.
If I could make a suggestion, we use a lot of acronyms in this industry, and since we have an audience, it would be really great if you would define the
Sure.
acronym. So could you please define RTI?
Yeah, so RTI is response to intervention, and so it is kind of what that name suggests is right. It's that making sure that we're responding to the students' needs who need some additional support.
Thank you.
With that, I'll look for a motion to adjourn.
Move to adjourn.
Second.
All in favor, signal by saying aye.
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 We are adjourned.